Right. Dr. LeBlanc, tell me a little bit about brushing the teeth. Even though we learn it in school, there seems to be some, different opinions out there. Up, down, sideways, round, soft brush, hard brush, electric brush. Just shed some light on it. Give us your take.
Right.
Give us your take.
All right, we'll go there, Helmut. Of course, we all know that brushing our teeth is important. Now, we've talked earlier about decay and gum disease. Those are the two things we're fighting with brushing our teeth. So I find that if I describe what decay is to people, they do a better job because now they realize that they're trying to scrub the bugs off their teeth, the bacteria off their teeth and their gums, instead of just trying to make them white and shiny. But really any soft bristle brush, the mechanical brushes are wonderful. For people that don't seem to do a good enough job with a regular brush. It's hard to find a toothpaste without fluoride anymore. So any national brand toothpaste that you like the flavor of is just fabulous. I hate to go to the F word, and you know what the F word is, Helmut? It's floss. That's where people seem to err the most. Flossing's a real pain. People don't do it. So where we're finding the gum disease and the decay are between the teeth. And it's unfortunate. Most people do a decent job of brushing, but they get the idea that that's all they have to do, and it's unfortunate because the patients that floss regularly are in such wonderful health, and more often than not, the people that don't floss regularly need more help than we should be giving them.
Got it. Anything... The people who do floss, forget the ones who don't floss, you got that point, but the ones who do floss, is there something you have to tell them, kind of pay attention to that or not, or something, some major...
There's a technique in everything. You're a much better broadcaster now than you were at your first broadcast. I'm a much better dentist now than when I graduated from USC 23 years ago. So there is a technique to flossing. If you're going to do it, you might as well do it right and get the benefits from it. And it's very easy to teach someone how to do that. Most of them don't know. So we try and teach them that. And it's amazing. Someone with some early gum disease, especially, that we teach how to be a little more aggressive with their home care, they come back 6 months later and they have poster perfect gums. It's absolutely amazing how somebody can help themselves in such a drastic way.
So what are some of these? Like when you floss, is there, should you put pressure upwards towards the gum, pay more attention on the side? I mean, what's the, give us some small hints there, and like you did a good job of like we're brushing off the bugs.
Right.
That's a good analysis. Right. What are we trying to do? Are we trying to massage the meat?
You're trying to remove... Yes, stimulate might be a better word. You're trying to stimulate the gum, and you're scrubbing the bugs off. So, I think a lot of people learned somewhere that to floss, you just snap in, snap out. That does get the bugs from between the teeth, but it doesn't get the bugs off the side of the tooth, especially in the back teeth where they're much thicker, and they really require proper flossing. So you just want to scrub the teeth. You snap it through. You maybe count 1, 2. On a top tooth, you just push the floss up against the tooth until it won't go any further up into the gum. And for a lot of people, it's painful at first because their gums are so inflamed. Even if they don't necessarily bleed, it's just inflamed. They're not real strong. But I tell them, keep it up. I don't care how much it hurts. In a week, you will not make your gums bleed, and it will not hurt. And sure enough, they come back and go, wow, you're right. I can floss like a bandit, and it doesn't hurt at all now. But again, it's something that's better shown. It's hard to describe it, but just ask the dentist, the hygienist, and they'd be happy to show you how to do it properly.
And now, about 15-some years ago, 95, 96, I think, I lived for a couple of years in India, and most everybody there used a tongue scraper. And I got used to it there. Then from there on, I don't use a tongue scraper anymore. I use my toothbrush to do the same. Gums, the palate, and the tongue. What's it about that? Good thing, not good thing?
It's a great thing, and they do make tongue scrapers, and there's nothing wrong with a tongue scraper, but me and you are as lazy as each other there, Helmut, and I just use my toothbrush as well. I think it might have more to do with breath. You get the fungus and the bacteria that harbor themselves on your very rough tongue surface. And it is definitely a good idea to brush it. It just keeps the entire bacterial count in your mouth lower. Your tongue obviously isn't going to get a cavity on it, but your oral health is just going to be a lot better.
So the only difference I noticed from when I was in India and did use a tongue scraper a few times is that with a tongue scraper, I don't seem to be gagging quite, with a toothbrush. There is that gagging effect there because that thing is relatively, thick in the back. And
you've got toothpaste on your toothbrush, and toothpaste is a soap. It's a detergent. Detergent has an action to it. It breaks up molecules. If you wash your hands without soap and then wash them again with soap, everyone realizes their hands are much cleaner with that detergent action that a soap will allow. So the same thing with brushing your teeth. You brush your teeth without a toothpaste, they just don't feel as clean. They're not, because you didn't get that detergent action that the toothpaste allows for. So same thing with the tongue.
Okay. So toothbrush is just fine.
Sure.
And definitely recommended to do.